Please welcome Dr. Brooks Russell to discuss traffic.
I'm short. I'm going to pull this way down, and I hope people wave if they can't hear me. So I'm here to talk today. I'm delighted to be here, and I'm here to talk about traffic safety, and hopefully there'll be some questions for me, and maybe I'll even be slightly controversial at the end, and that will generate questions. That'd be great. So my first slide, let's see how this works. So we've heard a little bit about the neurocognitive effects of marijuana, and you're probably familiar with these. And so the first slide is about how does this relate to driving performance. And so studies that have been done going back even 40 years in using experiments or simulators, driving simulators, have found that driving under the influence of marijuana, you can see differences in driving performance in some of these areas. A variability in speed and following distance, increased passing times, and worse performance when there's any kind of divided attention or multitasking required. And also some issues with visual field tracking, looking at hazards in the visual field. And one topic that sometimes comes up in this area is compensation. So a couple of these early studies suggested that drivers under the influence of marijuana, unlike, let's say, alcohol, perceive that they're in a state of impairment and attempt to compensate and drive in a way that might be considered more cautious. And this is really specifically seen in slower driving speeds. And so the issue with this is that there's some real limits to the ability to compensate. And these are unexpected circumstances, so things that you don't expect to see on the road or to come into your field of vision, or any complex task, multitasking. And these are circumstances that might be expected to contribute to crash risk. So this is a problem. And also there's been demonstrated difficulty to maintain concentration over long periods of time. And so some have heard the myth that people will say they drive better high. There's really not evidence to suggest that this would be the case, or biological plausibility to think that this would be the case. Another topic that comes up is this issue of tolerance. And so, and this is complicated because metabolism of marijuana is complicated. So there's individual differences in the dose that's needed to produce physiological effects, and as mentioned this morning, that can be different for the same person different times. And unlike alcohol, which is actually pretty easy to study, there's a clear relationship in the blood to the brain to the effects, and that's just less so with marijuana. So users can develop tolerance to some effects of marijuana, but there are limitations in complex tasks. So even someone who maybe doesn't show outward signs of impairment, they will show signs of that during complex tasks. And then I just want to highlight some of the most recent cutting-edge research that's coming out, and this is not necessarily limited to the context of driving. In fact, it's not in experiments with driving, but that if there's measurable levels of active THC in the blood, there's measurable impairment on tasks, not necessarily driving tasks, and that people with really heavy chronic use over a long period of time, particularly starting in the teens, may have some chronic impairment. So that research is really coming out of the National Institute of Drug Abuse. So what I want to highlight today is the evidence for an increased crash risk. So that's kind of the big question here, is does the impairment we see, does that actually contribute to crash risk? And there is some growing evidence that has some limitations, but it's becoming pretty clear that there is. There's been a couple meta-analyses of observational epidemiological studies. And there's some suggestion that an increased dose would lead to a higher risk, which I think wouldn't be totally surprising. My personal interest is in young drivers, and that's, I think, a very special population because they're at such an increased crash risk due to their age and inexperience. And it looks like with alcohol that's a multiplicative effect when the substance is involved, and I think we need to investigate if that's true for marijuana. And a point that really can't be overemphasized, I think, is that there are at least additive effects when you combine marijuana with alcohol, probably other drugs, and this would be true for other drug combinations because they work on different parts of the brain. This polyuse or multiple use of substance is really a problem, and it's also a problem because it's a prevalent way in which drugs are used. So I just want to highlight one of these meta-analyses. In my opinion, this is the one of best quality, and this is in your bibliography. They looked at, Asbridge looked at 9 studies, and he limited those who, there's a little typo here, it looked at THC in the blood, active, not necessarily metabolites, and then also acute self-reported use. So people had said they had used in the last couple of hours. And in these studies, most of which came from Europe and Australia, only I think 2 or 3 are from the US, they found that there's an increased crash risk of about 2, an odds ratio of about 2. But I should note, some of these studies used a threshold of 1 nanogram per microliter of THC in the blood. And for those of you who are familiar with this, in Colorado, the permissible inference limit is 5. And so for those studies that had the ability to look at those with 5 nanograms or higher, 2 studies, or 1 study out of France and 1 Australia, found that the odds ratio was much higher, around 4.7 for 1 study and 6.6 for another. So this is, I would say, a conservative estimate of the increased crash risk. And so another question is, how big of a problem is this? And I think the answer to this is kind of how many people are using, because the number of impaired drivers on the road is going to somewhat track the number of people in the population who are using a substance. And so we've seen with alcohol, the rate of alcohol use has gone down a little bit, drunk driving's gone down, but we've also had successful prevention campaigns in addition. But there's some tracking of use in the general population and then prevalence on the road of this substance. So after alcohol, it's the most commonly detected drug. About 4% of adults report that they drove under the influence of any illicit drug in the past year. That's about as good a data we have on that. And in the last roadside survey of alcohol and drug use conducted by the federal government, 9% of drivers during a high-risk time period, nighttime weekends, tested positive for active THC in their blood, although the level of that was not available. This is in comparison to 2.2% who had a blood alcohol level of 0.08 during the same high-risk time period. And this study will be conducted again in 2015. This was from 2007. And just a quick look at my interest area, high school seniors. For the Monitoring the Future, they've been asking about driving under the influence of marijuana since 2001. And it's about 12% of teens who have done this in the last 2 weeks. And here in Colorado, we're lucky to have local data. About 11% have reported driving under the influence of marijuana in the last 30 days. And importantly, this isn't just drivers. We have to also think about who are the passengers. And about a quarter of teens report that they've been a passenger in a vehicle where someone has been marijuana impaired. Okay, I think I'm going to skip this slide. I've got a couple of, and then here again is just some local data from Colorado with the year as the first column and the number of fatalities that occurred and the number of drivers tested. And the farthest, the last column is the percent of drivers who tested positive for THC only. And I don't know if there's much we can say about this, but there does look to be a slight increase over time from 7.6 in 2006 to 2012. So a really big limitation in this country is our census of fatalities is called the Fatality Analysis Reporting System. And unlike alcohol, the level of drug is not recorded, the time since intake, not all drivers are tested, fatally injured or not, and some states do a really good job of testing fatally injured drivers, and some states do a really bad job of testing. So it's a really incomplete picture of what the prevalence of drug is and the level and such. And this is the data set that transportation researchers really rely on. Another issue that comes up with traffic safety is the complications of roadside testing. And so there's issues of what to measure in what fluid, how long has it been since it's been consumed, and that depends also on the different mode in which it was consumed. And there's a lot of individual differences, and again, multiple drug use. So all of this is going to impact the physiological effects and driving performance. So here in Colorado, there is a permissible inference. So at 5 nanograms per microliter, it can be inferred that someone's impaired. This is in contrast to what's called a per se law, and that's what our blood alcohol level law is, and that is if you're above a level, whatever that is, sometimes it's zero, or the level of detection that you're assumed to be impaired. And I just want to note that in Colorado right now, this level of 5 nanograms per microliter is the same level for minors or those under 21 as for adults. And also it's the same for polydrug use, multiple use of drugs. And I think the rationale I've heard for this is that you want a level in which you don't detect or you don't find someone who has a level in their blood but isn't impaired. And some studies, again, out of the National Institute of Drug Abuse have found that really heavy chronic users, for example, they had a study with 30 individuals who had on average smoked 10 joints a day for about 10 years. And after 24 hours, none of these individuals had a level above 5 nanograms per microliter. So I think the question really is what percent of false positives or people screening for a level are we willing to accept as a society, and what level of truly impaired drivers do we want to find? And also related to this is kind of the philosophical question of where should the burden of proof rest on law enforcement to demonstrate behaviorally impairment, since there aren't really equivalents of breathalyzer tests for marijuana, and on what degree does it rest on the individual to demonstrate they were not impaired. So I've already highlighted that the fatality analysis reporting system is we need some resources there. Also, I think there's a real opportunity to evaluate the impact of different laws, and this is both within our country but also internationally, in which there are a lot of different levels that have been used in per se versus permissible inference. And that we just need to understand a little bit what's going on in this critical range that we've set as our blood level. What is the blood level that's really associated with impairment that we think increases crash risk? And finally, we have quite a bit of evidence for prevention approaches for alcohol-impaired driving, and so I think there's a lot of reason to think that those approaches would work for marijuana-impaired driving. And that's all I have. Thank you.
Thank you so much, Dr. Brooks Russell. Any questions from our panelists?
I'll ask one. It's maybe a bit naive. In terms of alcohol, there's a certain amount of drinks with so much time and certain things. I'm assuming that cannot be the case with marijuana because of the duration that the marijuana is in the body. I'm wondering if there are any specific sobriety tests that someone could do with someone before getting into a car that would help them determine whether or not they were impaired or not.
Like a friend could do or something?
Right.
I don't believe there's an answer to that question. I do know in Colorado they are training law enforcement officers to be specialists in detecting indications of impairment for a lot of different drugs, not just marijuana. And so that's a big push now, but I don't actually know exactly what they look for. And I'm not sure, actually, some of it there might be an attempt to keep some of that confidential anyway to not undermine their efforts. I'm not sure. But yeah. But if there is something, I think it would come out of that work.
Doctor, I'm curious if you've given any thought to some of the studies that show an actual decrease in traffic fatalities in states that have implemented medical marijuana laws. I think Professor Reeves, who was also at University of Colorado, was a part of a recent study. So I'm just wondering if you had any thoughts on those studies that actually show in states where more marijuana is being used, it is actually benefiting public health and safety due to the decrease of alcohol being used. I focused a lot on the meta-analysis in which there are some studies that find either no crash risk or lower crash risk, but I'm not familiar with any of those individual studies to speak to them. But I think that there is the risk, the cost to society of drunk driving is just really huge, and the proportion of fatalities that are related to drunk driving is large. I think it's something like 60%. So I think there are people who are hoping that changes can bring down that. I mean, that's. So I don't know if I can say much more than that because I don't know the specifics. I'm definitely not suggesting that people
right.
drive high. I wanted to bring that up.
Any more questions, Dr.? No?
Okay.
Thank you so much.